Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, there is nothing as soothing as the sound of a baby breathing. It's been a while in our household. I know about you. But, anyone who has had children knows that from time to time there can be problems. Now, it could be a baby with a snotty nose, a toddler with an earache, or a child with a sore throat. It's not easy being a mom, is it?
Oh, it's very hard, and it's even harder to be a baby. While these are common ear, nose, and throat problems, sometimes a bigger issue is the underlying cause and may require specialized treatment.
Here to discuss ear, nose, and throat problems in children is Pediatric Otolaryngologist Dr. Karthik Balakrishnan.
Well, thank you for taking care of that for me, Dr. Shives, and welcome to the program, Dr. Balakrishnan. It's great to have you here.
Thank you for having me.
So the sweet sound of a baby breathing, most of us have had the experience of listening to that. But what if you hear noise? What if something doesn't sound right?
So a lot of different noises can mean a lot of different things. The most common thing we see is snoring. And the good thing about snoring is it's usually not an emergency. As long as the baby's not working hard to breathe or struggling, as long as the baby's eating okay, it's usually something that can get worked out over time. And that's by far the most common thing we see. The things that worry us more...
so a little snoring is okay?
A little snoring is okay. Most kids will outgrow that, and sometimes we have to treat it, but even then it's usually not an emergency.
Okay.
The things that worry me more and that I hope will worry parents more and lead them to get their child checked out would be things like high-pitched or squeaky breathing, or what we sometimes call Darth Vader breathing or washing machine breathing, or sort of a low, rattly in and out kind of noise. And if we hear those things, then we think about some sort of narrowing of the airway, and that's a little more concerning.
And that can happen in a baby, and is that something they were born with?
It could be either. So some babies are born with it, and the most common reason we hear babies having squeaky breathing is a condition called laryngomalacia, which means basically the top of their voice box is a little floppy. That's something that they're born with or they develop very early in life. Other conditions, again, they can be born with like narrowing of the trachea, the windpipe. That can sometimes cause that Darth Vader-y breathing. And then there are other conditions that can be acquired, that they can develop after birth. For instance, Croup is a super common one, where you get a viral infection, you get some swelling and narrowing at the top of the windpipe, and that leads to noisy breathing. So it can be from a wide variety of causes.
Are these just breathing problems, or are they also swallowing problems?
That's a great question. Most babies, really, if you think about it, for a baby to coordinate suck, swallow, breathe, and to eat and breathe at the same time is very hard for any baby. So if you throw a wrench in the works and you give them some breathing problems, they're very likely to have swallowing problems as well. And the other way around, if they have swallowing problems and they're choking when they feed, it's harder to breathe. So they often do go together.
Did you ever have a child with Croup?
No.
Pretty scary, isn't it?
Thank goodness.
Aren't you supposed to open the refrigerator door and let them breathe cool air?
Right, or take them for a night drive where the window's open. Yeah, that cool kind of cool air can help soothe the airway and reduce some of the swelling. Sometimes.
Is that a viral infection?
It's almost always viral.
And
yes.
and what causes the noisy breathing or the difficult breathing?
Well, what happens is that the whole airway, from the voice box all the way to the bottom of the windpipe and the branches to the lungs, all of that gets swollen and irritated with Croup. But even in the normal airway in a baby, the narrowest point is right below the vocal cords. And so that becomes even more of a bottleneck. And when you get air moving through that really narrow area, you get that rattly, croupy breathing, and you also get that barky cough that Croup is known for.
But really nothing to do about it?
Not unless the child is in real distress. If they're working hard to breathe or turning blue or really struggling, then that's a reason to go to the ER and get checked out.
Yeah.
I learned that right away.
If they turn blue,
Yeah, that's a
bad
very
sign.
bad thing. So is the main culprit like tonsils and adenoids, or what is usually the problem?
So tonsils and adenoids are the main culprit for things like snoring and sleep apnea. That's by far the most common reason sleep apnea is for taking tonsils and adenoids out of a child. But these other types of breathing problems that we're talking about are a little bit lower down. They're more voice box and windpipe based.
And when we're talking about sleep apnea in children or babies, are they suffering the same effects that adults do, that they're not getting quality sleep?
Exactly right. So their sleep is disrupted, they're tired, they're irritable, and in children and babies, sometimes you see it as poor growth, poor weight gain. In school-age kids, you see it as attention and concentration problems. And then, of course, over many years, you get the adult problems of heart disease and stroke and things like that.
So how much snoring in children, like babies and school-age children, is okay? And how much is, oh, they're snoring too much, we should go see the doctor about it?
That is a really hard question. Looking at a child clinically, snoring by itself is concerning because even snoring alone without breathing pauses or sleep apnea has been shown to be associated with decreased school performance. So really any persistent snoring that lasts for several months or more probably should get checked. But it's not necessarily something to worry hugely about or something that's likely to be dangerous unless it's associated with those breathing pauses and things like that.
Tonsils and adenoids, it doesn't seem like kids have those removed as often as they used to when I was a kid. I mean, when I was a kid, you had a couple of strep infections. They said, your tonsils got to go. And you were jealous of any kid who had his tonsils out because they stayed in the hospital for 3 days and had nothing but chocolate malts. Mm-hmm. It's not true anymore, is it? I mean, you're not very reluctant to
now
do a
it's
tonsillectomy.
Strawberry.
Exactly.
Now it's strawberry.
Things are different.
You're absolutely right. You're absolutely right, Dr. Shive. So part of the issue is that we want to avoid surgery in children whenever possible. We want to avoid putting them under anesthetic. We want to avoid putting them through the pain of surgery and so on. But part of it, too, is that the reasons for taking out tonsils and adenoids have changed. So we used to do it a lot for strep. Now it's done a lot more for sleep apnea. And for sleep apnea, there are other treatment options we can try first, like CPAP and medications and things. So you're right that it's less common.
Another common surgery that I don't seem to hear so much anymore is getting tubes in your ears. Uh-huh. Is that increasing or is it decreasing?
It's still extremely common. So it is the most common surgery kids have in the U.S. It's about 1 million kids a year.
And why do they have it?
They have it either for recurrent ear infections, and there are guidelines that say how many per year, or for fluid in the ears behind the eardrum that doesn't go away after several months.
And why does the fluid accumulate? And is that a setup for recurrent infections?
Yes. So the answer to the second question is yes, absolutely. That fluid can get reinfected. It can also just affect the hearing and therefore affect language development, which is the other concern. The reason the fluid happens in the first place is because the eustachian tubes, which help us all pop our ears and equalize the pressure in our ears, don't work as well in children. And so we need to do something else to help them equalize that pressure.
You suggested that we should talk about foreign bodies in the ear, nose, and throat. I'm excited to find out why.
Well, every place there's an orifice, the kid will find it, won't, and it puts something in there.
Yeah, I am curious to find out why.
Exactly. I have 3 children, and 2 of them did it on the same day. So I tell you for experience it happens. Really, the biggest thing is batteries. I just wanted to take a second to talk about button batteries or disc batteries. Those are incredibly dangerous. So what we know is that in children who swallow those little hearing aid type batteries, that they can basically erode a hole through the esophagus, the swallowing tube, within 3 hours. So if a parent has any concern that their child might have swallowed a button battery, they need to go to the emergency room right away. That's got to get taken out immediately.
Never heard that before. I want to also ask you about the 3D modeling.
Oh, yeah.
For the pediatric surgery. Is that for the ear, nose, and throat type, or for the tubes in the ears surgery?
No, we use it more for the really complicated, the airway reconstructions where we're rebuilding a voice box or a windpipe.
And why do you do that?
It helps us. It's really hard mentally to turn a 2-dimensional thing like a CAT scan into a 3-dimensional picture in your head, I think. And so this helps us actually hold a model in our hands that's custom made to the patient. We can plan and practice the surgery, and also we can show it to the parents and the family and walk them through what we're going to do, and they can really sort of get that tactile impression of what the plan is. And it makes it a lot easier. We often will find things on the 3D models that we didn't notice on the 2D scans that might change how we do the surgery.
That has to be really helpful for families.
It's incredibly helpful.
Well, things you need to be concerned about when it comes to the ear, nose, and the throat from Otolaryngologist Dr. Karthik Balakrishnan. Thanks so much for being with us.
Thank you so much for having me.